represents change, and I hope you represent change. And I'm going to hold you accountable after this whole thing goes through. If I have the same lousy health care I have now, I'll vote for whoever runs against you. But the second aspect of this business of co-op, it's divide and conquer is all it is. We have Blue Cross Co-op. I'm a member of Blue Cross. It doesn't work for me. It's $821 a month, and they just raised it because I turned 60. It doesn't work. The public option, we need real competition with these insurance companies. The reason the insurance companies are sending new campaign contributions, they don't love Mike Quinn, but they want to keep their jobs. You need to abandon them and join us. Thank you.
Okay, let me just respond. First of all, I am very committed to expanding coverage and reducing the cost explosion, because those things are critically important to all of North Dakotans. Republican, Democrat, left, right. The challenge that we confront is we've got a system that is spiraling out of control in terms of cost. Medicare is going to be broke in 8 years. So I think all of us care about our seniors. I think all of us care about expanding coverage. The question is, how do you most effectively do that? You know, the debate between public option and cooperative plan is a lot less relevant to the answer to that question than other parts of the reform effort, according to almost every expert that's come before us. In fact, they're a little nonplussed that this argument has gotten down to the question of public option or not. What they say to us is there are other parts of this bill that are far more important to the issues you've just discussed than that. What are they? They tell us that what is critically important is reforming the delivery system in this country to have the kinds of systems replicated that now work. What are the systems that now work? Mayo, Cleveland Clinic, Geisinger, Intermountain. Integrated systems where teams of doctors share diagnostics expense, share overhead, administrative overhead, and where they have a patient-based system. That's the number one thing the analysts have told us we need to do to improve healthcare accessibility and cost in the United States. Second thing they have told us we need to do is reduce the tax subsidy to healthcare. And again, these are not just conservative analysts, it's liberal, progressive, conservative. They have come to us and said, you've got a $2.4 trillion tax subsidy to healthcare over the next 10 years. You need to go and put a levy on Cadillac plans, those that have a value of more than $25,000 a year, because they lead to overutilization of the system. And overutilization is a key reason for our problem. In places in this country, you have them doing 5 times as many procedures on a group of patients as in other parts of the country, and they're getting worse results. So just as Dartmouth Medical School concluded, we've got a huge challenge at putting this system in a reform mode. That's critical to all of us. On the question of public option, months ago, I was approached by what's called the G11 group. They're the chairman and ranking members of the key committees. And they said to me, Kent, we clearly have a circumstance in which you've got a group of people who are very much for public option, a group who are very much against. They're not the votes in the Senate for public option. Now, That's the truth. There are not the votes for it. So they said to me, can you come up with something that would bridge the differences? And what I came up with was a cooperative option. And I want to stress that. It is just that. It is an option. In the plan that we're working on, in the committee that I'm part of, you would have a series of options, including Blue Cross Blue Shield, including Aetna, including whoever else wants to put up an option. And a cooperative approach would be an additional option. Why does it have the possibility of bridging the differences? Because it is a not-for-profit alternative to for-profit insurance companies, but it is not government-run or government-controlled. As all of North Dakota knows, the co-ops are run by their membership. Membership-run, membership control. Now, people have said to me, well, that'll never work. Really? Why then is Group Health, a 600,000 person cooperative in Washington, working right now? And why don't all these other cooperatives, why aren't they failing if a cooperative model is not effective? How about Land O'Lakes? $12 billion entity, it's a co-op. Senex Harvest States, it's a $20 billion entity. Basin Electric Power Cooperative in this state. You know, we've got lots of examples of cooperative models that work. Ace Hardware is a cooperative. True Value is a cooperative. The Associated Press is a cooperative. So we got lots of examples of cooperatives that work. You know, I could go on with this, but the key point is I want to, and let me just say, I'm not going to do it that way. I don't do it that way. I go right down the line. I give everybody a chance. That's the way we're going to do it here. So let me just say this to you. The people of North Dakota elected me to get results for them. I got a pretty good track record of getting results for the people. That's why I've been elected 5 times. My obligation and my responsibility now is to try to get results for the people that I represent. It makes very little sense to me to be pursuing an option that clearly will not gain the support to pass. So what can be accomplished? That's what I'm trying to do. One final point I'd make to you. This is a very complicated subject, as complicated as anything I've ever worked on. And it's very important, because it affects everyone's lives. And it affects 1/6 of this economy. So we gotta, everybody take a deep breath. We gotta work together, and we gotta try to get a good result. That is my responsibility and all of our obligations. And here's the way I do it. I go right down the road. We give people a chance, ask a question, make a statement. I ask you to respect the others that are here, not to give speeches, but ask questions. I go right down the road. If it comes your turn and you want to pass, you just say pass, and I go to the next person. I found that that's the best way we get as many people a chance as we can. We'll start with you because okay. Yes, sir.
Senator, I'm not in favor of a public option myself, but I'm really glad that you've given an opportunity to these folks to have their say, because this is important to everybody. Mr. Quinn had asked one question that I don't think you had a chance to answer yet, and that is, it goes to the fundamental trust of our politicians. And you're more trustworthy than most, I'll give you credit for that, because you're pretty straight